Okay, we finally going live. All right, perfect. Welcome, welcome. Today it's a side position. A lot of customers can lay down on the back, on the belly, or lay down on the back, experience pain. Some people with spondylolisthesis or stenosis, it's really dangerous to put them on face down and working on the spine and put more pressure and create more problems. That's why the side position is very important and become really handy. So today is going to be side position, and we're going to focus a little bit on the lower back. I'll show you a couple great technique for the shoulders release, also neck and a pecs muscle. So it's going to be great. We're going to be doing this for an hour and a half. A few questions from the channel come up. How I price. So let me see how she said that. It's I answered this question again, but it depends on your area. So find your competitors, and if you're just brand new in the area, you don't have a lot of skills, charge probably the same price as your competitors, because if they've been on the market for a long time, they probably can manipulate the prices. Of course, don't go lower than like all those massage NV or other French ice massage places. Don't be like them. And it's all about your skills. It's all about your knowledge. And when you get those experience, knowledge, of course, you can raise the price. But this is how I raise my price. Let's say I am doing, when I start my massage practice, I'm doing like 20 clients a week. So 20 clients a week, at least you get the 80 people a month. So 80 people a month. When you get those 80 people a month in your like a client base, and they regularly come back, how people regularly come back? You have to sign them up with the submission now, like what's the subscribers or membership, like a small amount of price to pay, like I don't know, $15 or $10. What's this gonna give it to you? It's gonna memorize people to come back, because it's monthly. Charge them $10, and they just want to know what's going on. As some message comes up, let me take a look what's going on here. So so something not going, but that's okay. So it's just probably as usual those errors. So membership. If I open my bank account, or it's just click, click, bang, bang, comes up $10 for Massage RX, so we charge $17.77. That's mean I'm like, oh, I'm gonna get massage. It's also memorizing me. I'm gonna get my monthly maintenance. So this is really good tool, and this is 80 people. When I sign up, all those 80 people, I know they're coming back to me. I'm start raising these prices. So let's say I'm charging $97 per massage. Now I'm notified my members. I'm raised my prices to, let's say, $117. It's a $20. I might lose 10% or 20% of my customers, but the calculation, if you calculate, I'm increased for $20. All those let's say 60 people pay me now $117, which is those $20. I'm work less, but I get almost the same amount of money. So this is the time. This is the free time. Give me more time to learn, to get new skills, and grow bigger. So this is how I grow my prices. If you don't have those customers and you grow your prices up, it's not going to do anything. And just don't be cheap. This is my suggestion for you guys. Don't be cheap. Don't drop those prices. That's a lot of foot massages here for $20. I'm not sure how many massages you have to do to cover your rent and all that stuff. It's just waste of time and waste of money. If you don't have money to invest in your office and to rent a room, start the mobile massage and go to people's houses. And this is the kind of the way to start, the way to begin. And this is about it. I have a lot of questions, but we're going to go straight to the technique. I want to talk about this two booklets, which we have on our channel, on Patreon channel. You can buy that technique and just practice on your own. Or you can practice with us on this channel. Sometimes, sometimes, we do those classes here. We just work with you guys and you practice with us. This is assessment. The first book is assessment. It's give you idea how to check what's happening with the clients. It's not just a blind poking in people. It's to find out where's the problem is and correct it and help the person. This is the key. This is really, really like a simple book. It'll give you idea about human postural, human motion, range of motion, and get you idea how to professionally create the SOAP notes and the chart to understand where's the problem is, to find the cause. The next one, it's a book. It's a manual therapy and master massage therapy book. Here it's a supine and prone. We do this every month. We show this technique on our channel, especially for any like problems. So it's a supine and prone, from neck all the way down to the feet. Flip the person up with supine, and same thing, work on those problematic area. And third book, it's a marketing book. It's still working and branding, because it's really important. A lot of people ask questions. They graduate from the school and they don't know like how to grow the company. Like I said, it's a lot of what's they called, cones and how do you call that, cones and prones? Like it's a lot of invisible rocks. So when you drive in your ship, all those invisible rocks can hit you so bad, and this is what I'm teaching you. Because I'm hit all those rocks on my own, and I'm show you the way to escape all this, save a little bit money, and grow a little bit faster. It's all about the time. Now we're going to do side positioning, and I'm going to ask my model. Yeah, we need to take that shirt off. I think you can leave your pants on, yes. Just get yourself uncomfortable. And we're going to lay down, face this direction. So your back is going to be this direction. I'm going to get some pillow. So we don't need the face cradle. Sometimes I use the face cradle for the person who's like lay down on the side. I'm doing this. I pull it out and I put right under their head. But I have a pillow. Why not? So go ahead, lay down under the sheets. And let's begin. So side, so slide off. I put the towel, all stuff, there we go. So here we go. Every time change the sheets between customers. All right, let me get the other camera turned on and see how this is going to work. I think it's going to be great. We're going to learn a lot of good stuff. Yeah, you guys see everything? Perfect. So I'm not using a lot of oils. I see a lot of people use oil. I use little muscle rub or CBD. This is my stuff right in here. If you guys see it, put this on this camera. Great stuff. And it's a mint termical in there. Okay, so first of all, if people come in with a lot of pain, I will never put them down. I put them on the side. And if I ask the person, where's the pain? Is it on the right side or on the left side? I always put the painful side down. Because every time the gravity, they put this kind of pushing against that painful area, it's for some reason disappeared. It's become non-painful. Try it. But David don't have any pain today, but we just kind of, how I'm going to imitate the pain, so be careful. And we start with let's start work with our hip, with our glutes. This is a really tricky muscle, that tensor fascia latae. I see a lot of people in this position, they start working on those IT band, they sit down and they just push against that bone. Let me get this camera a little bit readjusted this way. Can you see me? Perfect. So what they do, they start really like digging there. And I don't know, elbow, people are like, whoa, whoa, whoa. Yes, it's feel, I don't know how they feel. Is it painful? People just come for massage to feel pain. No, it's not a good idea. So we not doing the IT band. Only this tight muscle right here, and sometimes it's really sensitive, those medius gluteus and tensor fascia latae. But guess what? A lot of trigger points up here, which is not the trigger points, the spots, you can work on it and you can release that lower back pain. Sometimes people come in and they said, wow, you work on that, my pain is gone. I was one of those witness when the person, the chiropractor, work on this area and my lower back is disappeared, like lower back pain. And that was when I beginning. So also great for hip mobility. So what I'm going to do right now, I'm find this tensor fascia latae, gluteus, and I'm just apply. You see, I'm sitting up here, and all I do, I'm apply a little bit pressure. I can sit, I feel comfortable, or I can stand up, and I use this part of my palm, and I just apply to right in here. And what I'm asking the client, start moving this knee, so like high knee walking, and that's what people do. How's it feel? I always ask how they feel.
That's good.
Feels good. Sometimes they say, whoa, whoa, it's really sensitive. So just apply. You can apply thumbs too, and you extend it. So he's working now. I can also add the band right in here around that quadriceps, holding in my hand, another hand apply, and also he's work on those hip flexors, mobilize everything. So this is the great thing. And this is what I do. How's it feel?
Feels good.
Feels good. Like I said, a lot of sensitive spot up here. Also, sometimes, not sometimes, I'll let it go. I do this. I put the hands in the stretching position, kind of open it up. And what I'm doing here, it can be the cross arms or not this way. Let me see if I can, which way is going to be the best to show you guys. Yep, I think this one is best so you can see me. Okay, here we go. So what I'm doing here, like I said, it's not really comfortable for me to show you and show you my butt, but the idea is open this up. You see what I'm doing here? I'm working on that space, lower back space, working on this QL if it's spasming. Also, let me show you. I can this way. I'm applying my hand up here. You see, I can move, and this arm is going this way. So this is not visible for the other camera, but you can see me on the main camera now. So I'm pushing this way. How's it feel?
Feels good.
It feels good. Another technique to working on those hip flexors and hip mobility, I ask my clients to grip, to pull the lower leg close to the chest. So this is what he's doing. And he's grab it. And I am undrape this one. So watch. I'm grab this leg and place right on my hip. So let's get this camera. It's kind of weird angle. It's really hard to maintain two cameras at the same time. Here we go. So what I'm doing here, I'm grab this hip, make sure he's okay, and I work on all this hip flexors and quads muscle. I'm not stretching it. So you see, I'm control the motion. Next one, I grab that knee and place my other arm right on that hip, right on that ilium. You're going to feel that. And what you're doing here, you start moving your leg forward. Don't do too much. How does it feel?
Very good.
If the client is not going to hold the other leg, you're just going to move, and he's going to move the whole body. But if he's going to hold that knee, that's the little key. So you start doing this mobility, and you can rotate up and down. You see what I'm doing? I use my body. I use my hips. I'm standing up and down. You see my legs? How's it feel? And I get more. I can get to this first barrier, say to push against me. So he pushed towards that. I'm resisted. My other, hold on. This arm is just holding this knee. You see that? It's holding right in here. So it's push against me. And I'm 1, 2, 3, 4, and release. And I can go a little bit more. So working on those hip flexors and also gluteus medius, tensor fascia latae, and quads. How's it feel?
Very nice.
You see, he's losing the pillow. He's kind of moving, but that's all right. And release and let it go. Also, if client come in and they say my lower back is stiff, you guys see it? What I'm just going to go drop this leg off the table. Can you come a little bit close to the table? Like kind of in one line?
Yeah.
Right here. So you see, he's close to the bed. And all I do, just drop this leg down. I drop this leg down, grab that ilium, and I push it down. Stretch that QL a little bit, not to stretch. Open this up. Doing this way, or if I want more, I grab this ilium and pull towards me, and watch, my other leg is pushing this leg down. You see? Let me get this camera a little bit this way. It's a lot of adjustment, guys, yes. I need a cameraman. So I push this leg down with my leg. You see that? Is that more? Here we go. And here I grab that ilium and I just kind of juggling, not the jog, pulling, and open this up. Okay, you see? Also, I can do this, push this way up. I don't use any oil. If I have oil, I'm going to slide off. So I grab that fascia, and I'm lean. Lean, how's it feel? Very good. Open this up. Open this up. So this is couple technique for those hips and lower back. And we have Marina, so she will try it. Yeah. So we're going to try it. That's all right. Come over here. She got COVID. We don't care about COVID. My dad got COVID. Everyone gets COVID. No one's scared anymore of this bullshit. All right. So let's try this hip mobility first. Ask him to bring this one.
David, please keep this one.
Keep this one. Yes. Take it and grab it. Pull towards your chest. And now, yep, put this one right on the hip. Perfect. Grab this one with the knee. So you see she's grabbing. The right arm is kind of pulling this way. Yes. I want you to, you see, you kind of pull in away. I want you to just lean forward, like a, here we go. You feel that? Yeah. And pull this one up here. You feel that? Yeah. How's it, David, feel? So watch. And this one attached to this butt, like this, and you turn. You see? Yeah, you turn. So what she's doing, she bring this arm close to the body and this away. This is the motion. This is the motion. I know you guys see us. Motion. Here we go. Perfect. Yeah, and she stretch it down. She pull it out, and you can grab this. This way is better. Hold on. This one is better. You just grab it. You see? You grab the ilium bone. You go around just the elbow, and look, you're so powerful. You're straight back. You're not rounded. It's not hard because you kind of wrestler. You grab it and you pull it. This is the key. You want more? Yes. Apply this hands up here and grab with another. That's the key. You see? I'm leaning my customer. If you are a female, place some pillow. I always have double pillow. Put the pillow and get this work down. Okay, try it. Is fine. See what she's doing up there? Let's see if we can go a little bit more. Perfect. Yeah, this is going to be next one. You got it? So we open this lower back, mobilize that hip. Next one, we can just get this customer back in one line, get a little bit space, and working on that erector muscle, the lower back. Like I said, sometimes people come in and they experience pain. Can you just, no, right here. You don't need to be, you stay right in here. So, because this camera. And again, I don't have any oil. I don't apply any oil. Tiny bit, this magic balm. I put on those erector muscle, QL. And what I'm doing here, you see my arm, my elbows come close to my body. I'm not just doing this because it's going to be hurt. I'm going to hurt with this clavicular. My elbows come right in this socket. My thumb or knuckles, I'm applied to this laminum groove, and watch what I'm doing. I move with my leg. You see, I move with my hip. My hand is just attached, and I'm going this a little bit fast with the camera, but this is my speed. So I'm just working on that, and every time you feel something is pushing you out, that's mean the vertebra is rotated. And what you're doing, you just work on that, maybe ask him to move the leg or move the torso, and you will feel that bone, something poking, not the poking, moving your thumb out. So always, or breathing, even breathing techniques, I'm like, here we go. So let's say I found something right there. Go ahead, move your leg up and down, like walk. Do you feel that? He feel that too. And I'm going all the way to this thoracic area and let it go. I work the both side. Of course, I'm going to ask him to flip on the other side and just work. You see, I'm use my body. Let it go. And let it go. And I push with my body. You see the elbow is there. My back is straight. I can go deep work. You like it? And of course, everyone like it. And this is how you work on those laminum groove and spine health. Okay, you want to try it? Yeah, you don't need to oil. Exactly. So get your elbow close to your body. And you see she used 3 fingers. It's absolutely okay. Feels great, yeah. Feels good. Elbow and move with your body, yes. Use 3 fingers. If the girl is a big guy, so you can even use the knuckle. Yeah. You see, she's going to try to lean forward. Yeah, get yourself straight. So I'm just standing. That's what the yoga is really handy. All those warrior position is really work well. Okay. What's going on? Oh, disconnected. Oh, reconnection successful. Okay, for some reason, I think it's a lot of people join late. People watching, great. Just say where you guys from, what's your name, what's your goal. So for the future, we're going to start doing those classes specifically for you. If you join this Patreon, all going to be there. All premium information is going to be there. So you see what I'm doing? I'm lean. I'm lean with this elbow. I'm sitting. Is that okay? And this is my fast speed. So this is what I'm doing when I'm truly work. That's it. In person, I can feel the muscles get relaxed. Everything is good. And probably finish right in here. I don't go this thoracic area a lot. Next one, a lot of people work on the QL this way because this is the best way to release them. Yes. I can put this leg in position of stretch, drop this down. You see it's already opened this up, that rib cage. We already did kind of decompress, open that space. The next one, I usually stay here, yes, and doing that. But for the camera purpose, I'm going this way so you can see it. I'm apply my forearm on that QL and ask him to breathe. If any pain, I stop doing this technique. So I just apply it and ask my client now to move that knee this way, like he's high walking, like, there we go. Like he walk, he's going to feel that. I'm always wants to activate the muscle when I'm apply it. Yes, how's it feel?
Very good.
And I push towards the spine. I'm not, when I feel that vertebra is coming, get tense, I release. I don't want to push on the spine. Never push on the spine. Never apply pressure on the spine. Very slight. It looks like a brutal, but it's only like 10 pounds. And let it go. All right, so let's, Marina, do those wiper shield. Wiper shield, you just know, sit down first, here. Sit down. And all you need to do, you need to just pull this up. Massage therapist not working this way, right? But, okay. Place this down, like sitting, and that's it. And just slide that thing.
It's dry, it's not good.
It's not dry? All right. If this is not going, because we got a little bit more, all right. We're going to spend more CBD on David. He's going to pay for that one. Yeah, it's like $36 for this can. Yes, it's great. This looks really good. So you see what she's doing? She slide that elbow. She slide that elbow. And it's really good. Yeehaw. Let's see how we're doing up here. Yep. The other one, yes. You can be on this side, same thing. You just sit down. I just show this way. You see? It's not the elbow. It's kind of forearm right in here. And I'm apply this down this way. And if the person have a flat back, I'm not doing this. It's only with this is the curvy, because if we get this curve in, we're correcting that lordosis, okay? There we go. All right. Yep, you can sit down. Always communicate. Very light. She go a little bit fast but slow. Perfect. How's that? Ask your client.
Yeah, it's good.
Yeah, she's trying to program client too. Is that good? Of course you're going to say good. You need to ask his experience, how you feel. But that's all right. It's a good stuff, actually. Yeah. If he's good, he's laughing, he's good. All right, let's not rushing. So what we learned today, it's a hip, working on those tensor fascia latae muscle, working on those gluteus muscles, and of course, give him the homework for this mobility. Great. Excellent. So what we learn in lower back, you guys, I know we go a little bit quick. We learn wiper shield, wipers. We learn this work on those erector muscle, the laminum groove with my elbow in. We learn this, open this up with the cross arm. And like I said, if I stay, I'm staying this way. You see what I'm doing? Drop this leg down and I pull to the side. This is what I'm doing. I pull this way and I breathe. He's a breathe. Always don't forget to breathe with the customers. Customers breathe and exhale. Let me show you this in the real life. So in a real session, drop this leg off. He's already pulled the stretch. Let me stay this way. Just pretend I'm standing this way. All right? And what I'm doing here, you see, I'm applying, this hand's applying here, and this one is here. Hey, take a deep breath, inhale, and exhale, I'm apply. Yes, he's breathing. And my arms are straight. I'm not leaning because it's hard for me. If I'm standing this way, I'm just doing this. Great technique. Great technique. Next one, we learn to grab that ilium. You come up. You see, I'm leaning. I'm lay down on this hip, and I pull. I use my whole body. I don't use my arms. I see people doing this. It's really challenging for you. It's really like you put too much pressure on yourself, you're going to get tired so quick. If you do 5 clients a day, you're kind of be exhausted. So here, I'm not exhausted, and I'm just enjoying and having fun pulling. One more, apply, and pull. How's it feel?
Very good.
Very good. He said it's very good. Open this up. Open this up. So I said this in the beginning. When my clients can lay down on his belly, and can lay down on the back, because it can be stenosis. Let's say some older guy come in and say, "Oh, I got this stenosis," and I don't know how bad stenosis is. I'm not going to put him face down and just put more pressure on the spine. I want this way. It's a more safe way. And people love it. Also, people with extra weight, they can lay down on the belly, or the back is rounded, so the head is in the air, or it's just a lot of factors. But people say, "Oh, I have some operation or hernia." I will never push them down and start working on those spine. Yeah, like I said, always communicate. We learn this in communications, and this is the key. Next one, we're going to work on thoracic area. Most of the time here, I'm just working on those serratus anterior and posterior muscle, because we slouch forward, and this muscle, especially anterior, become really contracted. And a lot of people not breathing. This one is really powerful technique. I pulled David, and you guys, I put this table for you if you guys want to practice on that one, but you already kind of a little bit. That's all right. All right, yeah, we have a table behind the camera so people practice up there. We get this arm. If the person say the shoulder is a problem, I will never going to do this. But if shoulder okay, I'm kind of leaning in right here. Is that okay? You feel comfortable? I know David have a right shoulder's rotator cuff, but he's doing, yeah, left one. Yeah, that's what I'm trying to say. The other one is the rotator cuff. So I will probably not put in this position. So here again, I don't use the oil. And let me see if I can get this camera a little bit closer. So, and you guys can practice it. No oil. If I want it a little bit, okay, just because I like David, I put this little bit CBD here. It's a muscle rub, and he's going to feel good. Let's get this little freezing sensation. It's called eagle. I cross my thumbs like this. Wow, little birdie, right? I'm apply this palms right on this rib cage. I'm not pushing down, like I'm not doing this. I'm not trying to squeeze those rib cage. All I do, I slide up. A little bit pressure, 5 pounds pressure, but the idea is pull this up. And here we go. What I'm going to ask my clients, I'm going to take them breathe exactly. In each breath, he breathing, I pull towards that nipple. If you're going to ask me if this is woman, female, what I'm get that sheet, I come right on this breast area and ask the client to hold with this arm. So you see she's kind of covered like this. Now my serratus is okay. The boobie is right there. We're not touching that. If I need to go under the boob and I feel that, I always communicate with the customer and ask him to sign the paper, because it's a medical. We're going to get there to this area. If the client, trust me, they're going to be okay, because this is really great technique to release that. So ribs, you find those ribs and you work. So big inhale and exhale. You see my stance, my lower back is straight. I'm not rounded. I'm not doing this. I'm not doing that. I'm not doing this. I'm straight. My arms are straight, and I'm pulling. One arm is come right in here. Guess what? All those lats muscle, trapezius muscle, I pull that scapula back, because most of us is rounded, and work on this muscle at the same time. Let me just show you once. and you guys practice. Yes, the eagle. Walk, walk, eagle. You know, when you've been kids, you get those shadow on the wall against the lights, and you just put these fingers and look like an eagle or pigeon, whatever you can imagine. See my straight, pulling towards that lats. Couple more. And release. It's getting hot in here. Here we go. You want to try it? Look at this. Perfect. Straight arm. Find the ribs. Yeah, and push. You see that postural? Perfect. She's standing. She leaning with her hips. She's leaning with the hips. They don't see me on this one. She's leaning with the hips. Yes. This is the perfect for pregnancy. Here we go. Another use this position for the pregnancy. If the client come in and say, I'm pregnant, I will never put pregnant person down. No matter how many months she is, like 1 month, 2 months, I put it in the side position. And I'm not going to work on this plantar fascia latae. I'm not going to work on those hips and lower back. Maybe work on upper body, just support that back. How's it feel, David?
It's really good.
Yeah, he's going to be so good today. This side is going to be nice and released, and this one is going to be tight. Yana, you want to come over and try? Okay, we've got another person here to try it. So many hands on David today. All hands on you. No, you don't need to oil. You want that fascia scoop. Like I said, if you guys put too much oil, yeah, go ahead. So, dominant leg in the front. Which leg is your dominate? Hands straight. There we go. And you kind of watch. Like this. Cover 2 thumbs on each other. And this one is drive towards the nipple, but you don't touch. And this one is towards down. Try it. Yeah, on the top. We'll put on the top of each other. There we go. It doesn't matter. Like I said, make yourself strong and push with your body weight. Look at that. That's really good. You see that straight back? Perfect posture. Lean with the hips. The arms is straight. If you bend your arm, you're going to put too much pressure on your pecs muscles. Yes, you're going to really use your pecs, deltoids. Here we go. How's it feel?
Really good.
Really good. Excellent. So, and this is great video. So you guys, go ahead, do Yana one more time and tell the clients how you can help them, who you are and what are you doing. Yana, she's a massage therapist for 7 years. She learned this medical massage now, and she can come to your house, guys, can help you with a lot of issues. And she's focused on the stress-related therapy. So it's a lot of stress therapy. So you don't need to drive to anywhere. She can come to your house and do massage. Same with Marina, right? All right. So next one, you guys good with this technique? Perfect. So yes, call those girls, book them today. They do an amazing job. And they're always on time. They're never late. Especially David. He's never late. Okay. Yeah, he's always in ahead. Okay, next one, we can work on this. We can work on that shoulder mobility. This is what I'm do. I am grab this arm like this. I'm holding it. Let me see if I can pull this camera a little bit down this way. Okay, here we go, because now it's more open. Here we go. So I'm standing on the side of the table. I grab this elbow. I always ask, if any pain, you let me know. Okay? I grab this elbow, and this is the grab. You can grab like this, you see, right under, right in here. He grab you. So he holding you, you hold this elbow right on this. What's the area? How do you call this? It's not a... Yeah, bend of the elbow. Another one you can grab on the top. So you see, and you You can do like an arm rest. Yeah, arm rest. This way or this way. And what I'm doing here, I grab that scapula. I grab that whole scapula. I can even get a little bit, hook the scapula under. You see, like a little bit up there. And what I'm doing here, I get myself in a comfortable position. And what I'm doing here, push the scapula down and move this elbow towards me. See what I'm doing? And try to get, I can go a little bit lower, have to be more, but this is probably it. And I can get to this first barrier right in here. Ask to push him down, so the elbow is going this direction, pull down. He's activated all those lats, yes, and let it go. And I'm going more. So I'm mobilize that shoulder. You can also work on those lats. So push this down. You see, I'm use my body weight and pull. Next one, you can switch on the front, but this position, my arm is coming right in here. Get this elbow against my body, and I'm doing this. You see, I'm trying to get that scapula, do the traction. Does it feel okay?
Yeah.
You see how rounded the scapula is? I want to pull more here this way. Doing okay?
Yeah, that's good.
Good. And don't rush yourself. Easy. So get to this first barrier, push down. He's pushing again. This direction. If the person doing wrong, pulling, show it to him. I want you to pull this way. I want you to pull this way. And now, attach and let it go. Yes. And you see what you're doing? I'm going right in here. Boom. In the back, always down because we slouch. In the front, always up. Not always, but most cases. Like I said, depends what person doing. And let it go. All right? Ladies, all yours. Yeah. So it's a 90-90. Yep, you grab it. He grabbed her too. Boom. Look at that. You see she correct him too. She put him on the one line. Some people lean. Yeah, just pull. Grab it. Yeah. Whatever. Yeah, whatever for customers is easy. Pull. And you just, twist your body like you're dancing, like you're doing this. Like a robot dance, whatever. Yes. Back straight. Don't rush yourself. Just easy. It's hot in here because it's 106 degrees today in Los Angeles. And massage to do in a big room with big windows, it's challenging. Yeah, she's rotated. I'm not, like I said, everyone do what they do. I'm not trying to rotate a lot of this position. How's it feel? Always communicate with your clients. If clients say, oh, and the trick is, the client will never tell you he's in pain. But if you ask and he say, yes, I feel pain, what you do, you back up. If person feel pain, that's meaning something you're not doing right. And if you're not doing right, you can re-injure a person and create more problems. We're going to get there soon. So we work on hips, lower back, open those ribs, and it's a lot of techniques. We'll just show you a couple few. Yana, come over here and just work on that shoulder mobility. Here we go. Put this in 90-90. Grab, ask him to grab you. Whatever he wants. Put him in 90 degrees first, like this. Stay straight. Get a little bit close. You're tall, so. Perfect. And lean this down. Very easy. So find that. Yeah. It's. Yeah. Watch me. Watch, exactly. You see what she did? Let me show you what Marina did. She come up here first. She put him here. And you see she's support. It's not going anywhere. She's not moving here. She just support, and this is like resist. Now you only move here. The top arm is moving, but this one is slightly just go a little bit down. So you see, I'm use my body. This is what I do. I push my hip forward, and this arm is pulling down. It's very easy technique. Some people say it's hard. Go ahead, try to do it. It's all about body mechanic. Grab this first. Apply this elbow towards your body. Hip, watch. Hit this elbow, like put right here, and that's it. And you just move your body. And you move your hip. Yes. Here we go. Yeah, because if you guys use your arm, if you pull with your arm, it's going to be difficult. There we go. Look at that. Yeah, this body. And she can do all big guys, football player, basketball players. Give us a call. Where's those Lakers guys? You guys terrible. Yeah, So other way, he can grab you, and you're doing here, and you drive the scapula. So you see what she's doing? Watch, you just kind of like rotate your body. This is the whole movement. You're like, this is why I said massage therapists have to get this thoracic mobility perfect. If you guys do those tests, if you're standing and you're not able to do that, you can't practice because you're going to injure yourself more. 90 degrees. Perfect. And you're doing this. Perfect. Great. Don't rush. It's just easy. So that's the motion. Motion from the hip. Right there. How's it feel? Better? Okay. Always practice. If you don't like it, if something happened, like you don't know, is that good, or you feel weird, always find that. You see, she's kind of start bending. Yeah, straight. This is the position, the warrior position, and that's what you do. From this warrior, you just lean. You can see me. This is all you do. So this is hip, and now you just get this rotation. Rotate your torso. Great exercise. Perfect. Yes. Get the elbow. Yeah. Always with the body. Yeah. It's kind of a little perfect. You see that perfect postural? What she's doing? She moved from the hips. She pulled everything. It looks great. This is really good. And you're not.
Are you okay?
Yeah, he's fine. This is with the scapular. We can also work on those rhomboids. I see people. This is my favorite too. Like I said, I do a lot of side positioning. Between the shoulder blades, I'm apply a little bit CBD again. I don't know. I'm so good today, to David. Same thing. Apply my elbow to the table. If it's not electrical table, you have to find out. Let me see. You have to find out this perfect level. Like I said, this is my level. You see, I'm 6'2", and my table, this is my, see the distance between my arms? It's like another 7 inches because I want to keep it low. I see a lot of massage therapists at massage school. They said you have to stay and you get the fist, and this is what massage level is. This is what's going to happen. You're going to get this monkey thing. You're going to jam this brachial plexus nerve, tingling, numbness in your hands in a couple of years. Not a good thing. Okay, rhomboids, trapezius muscles, all those neck. Get this arm on the body, on the top of the body. I'm grabbed with my one arm, and the other arm I push against my hip again, against my belly. And what I'm doing here, I'm just move my hip forward, you see? And I'm get this right around. So I push with my body, my back is straight. Working on those muscles. Sometimes people say, oh, I'm really knotty up there. I get those knots everywhere. Yeah, because sometimes they round it and you work on those ribs. You're touching the ribs. And they feel good about it, but, you know. Okay, here we go. That's really easy technique. Everyone know that one. So you work on that around the laminum groove, a little bit more close to the scapular. This one is easy. This one is easy. You girls probably know that, right? Many, many times. Open the pecs and chest. A lot of people with rounded back, they slouch, right? So this is what we're doing. We're gonna come in. I still have to figure out this camera. It's kind of good and at the same time. All right, open the pecs. If I have the slouch people forward, I grab this arm, hold it like this, place right behind the head. Make sure the head is straight. Okay, you see this positioning? I grab this elbow. It's actually another technique to work on that, open this lats muscles and scapula. Same thing like we did. He holding it. This is another variation what you guys did. Apply to this scapula, and what you're doing here, yes, you drive that scapula down and pull this elbow towards. You see, you can actually use both. You can breathe. You can leave this, like you say, you leave, lock it with my arm. That's it. And apply another hand and pull. How's it feel? See how easy is that? Right in here. I'm holding it. Highly recommend you guys, if you want to learn this more technique, go to this Aikido guys, like Japanese guy where they grab your arms like those Steven Seagal, do all those crazy stuff. Crazy man. All right. So, in the next one, so I push this, he holding the head, I'm apply 2 fingers pressure, not much. I'm pushing this way, direct towards the camera, this way. The other come on the scapular and close to my hip. And what I'm doing here, I'm doing this. Watch. I push to the midline, medial, and this one, push away with 2 pounds pressure. And that's the action. There we go. And when I work a little bit, like 2 minutes, let's say 90 seconds, I'm get to this first barrier, I feel that, I'm supported, and I ask him to push this elbow in and resist me towards the nose. Here we go, push, and relax, and I take him to the next barrier, more. How's it feel? Do you feel stretchy kind of part in your pecs?
Yeah.
How's the shoulder feel?
It feels good.
It feels good. So this is all about. All right, we got 15 people. Great. Put your name, write down where you're from, what's your state, what's your country, and we're going to be your friends. Here we go. All right? And this is a technique. You can also, if you don't want to do this way, you just stay, lock the scapula, bring up here, just show you for this camera, and ask him to push down, and he resists, you push more. Relax, and you get a little bit more. But this is difficult. Always lean, lock this elbow in your body. You see it's not going anywhere, because if it's right here, you're going to get pain in your elbow and everything. Too much pressure on your arms. I have to come from your hips. All right, ladies. Whatever who's jumping. If you want to skip, just let me know. Okay, perfect. Yana's coming. She want to practice on this one. We got table behind the camera. Practice up there. Perfect. All right, here we go. So, if you work on this left side, I mean he's on the right side up. I always use my right arm dominate. So go ahead, find that scapula, attach to your. Get this for the first level. So what she's doing, and perfect. Get this right in here first and hold. Get this elbow close to your body like this. So you see, elbow is close. It's not here because it's right in here, and that's what the force is. Perfect. And ask him to pull down towards the face so he's resisted. And relax. And he pulled towards the nose. Yes. and you don't allow him to do. So you hold it and you don't allow him to shift it forward. Yeah, pull. There we go. Ask him to pull gently. Don't pull hard because he's a man, and if there's like a and if person is strong, he's gonna pull right away. So just say, pull gently towards your nose, and he pulled towards the nose. And this is pecs minor, and if you guys pull the elbow towards the knee, ask him to pull towards the knee. Yeah, he's doing different way. It's a different group of muscle now working. If I'm straight down, my pecs minor. If I pull this way, pecs major and minor if you put diagonally. So this is reactivate. Yeah, good question. I will probably do like a 3 times, 4 times, depends on person.
Like towards the
Yeah,
nose and
yeah.
with the knee?
Yeah, 3 times, 3 times. It's like it depends. One more thing, don't use this technique with people with the shoulder pain. Like person come in with the shoulder and you start doing this, don't do that. This is the healthy shoulder. We're talking about mobility shoulder. We're talking about good healthy shoulder. If person have difficulties and you not can bring it, just gently. Always feel that barrier. And I always look at the face. And if people doing this, stop. Only if you don't like client, you can do that. So you can just massage the shit out of him. So that's the key. Great. Next one, a lot of people ask me how to release traps, and I see the people lay down. They always kind of grab that trap and squeeze it, and it's a lot of work for that. What I'm do, I bring this arm always right in here, like this, and so easy. I'm applying my left hand, non-dominate. You see, I'm just kind of slide that shoulder down. Now it's a lot of muscle activation here right now. I ask him even to play with me a little bit. Go ahead, shrug, and I'm resist and relax. Big inhale and exhale. He's exhale, I'm get more. You see, he's like more. Feel that area. How's it feel?
Good.
Now watch. I'm turning myself towards. This is my front line. I always use the midline of my body. So this is my front work. This is what I'm my area. My midline right in here. I get my fist, just like that. Fist, you can use palm, whatever you want. I usually use fist. I'm apply that pressure, ask him to breathe deeply. Breathe, person breathe, and I'm slide my fist down. I'm not going to anterior neck. I'm going a little bit posterior. Let me grab this camera and pointing down so you're going to see what I'm doing exactly in here. Yeehaw, look at that. We got some studio here. So you can see only my hands. Again, I'm apply. Now you see this area and I'm going right to this occipital on the side. So here we go. Push it down, midline, and slide my fist down. I'm not tired. I can do this as long as I want. I feel that bumpy area. Take a deep breath. He's breathing. He's resisting. This is my speed. I see a lot of people doing this. Whatever this do, I don't know. It's just, but this is the key. The person, his brain release that. You release in here first. Just relax and deep breathe. Here we go. I calm my customers down. I want him to relax. And that's the key. Okay, sliding down. Sliding down. There we go, a little bumpy up there. So if I found that most tension, I ask him to shrug in this area, and release. Shrug in this area, and release. Shrug one more time, and release. And I'm going all the way up to this occipital area. You can also work on Australians, I'm not going to show you. Whoa, here we go. I'm not going to show this technique today. It's going to be with the neck.
It's good for headaches too.
Is great, yes. A lot of people come because they do this monkey. I call this monkey stance. You always stress. You shrug your shoulders all the time. You hold that. You know how Africans, they catch the monkey. They found the tree. They do a little crack like a hole, and exactly when the monkey can squeeze this arm like this, and they put the treat inside. So monkey squeeze, and they grab that treat. But she turned the hand, right? And now the hunters come in, and the monkey can let it go the treat because that's it. She's stuck. Her whatever brain, she don't want to let it go, and she don't understand why she can escape. All you need to do just let it go the treat, turn your hands, and pull it out. This is how hunters in Africa hunt those monkeys. So you see, that's why we always hold something in ourselves. Everything is hold. Your stress, whatever, your job, emotion, and that's right in here. And that's create this brachial plexus nerve. Everything is jammed, and all those tingling down this neck. You kind of slouch forward all the time. So release that. And Marina, Yana, David, me, this is what we can help you with. We can work on that area and get your stress level lower. Release your cortisol. That's the idea. Get your dopamine. Make you a little bit happier. So book our appointments, especially if you got those trapezius tight. And this is what we're going to do for you. I'll show one more time. And Yana come in with Marina. And that's the idea. You see how cool is that? And this is relax. Drop those shoulders down. Get this tension away. And all the way up. There we go. Next one, I'm just showing you two things up here. And the girl's going to repeat that. And if you have any questions, we're going to answer the questions. You see how head is tilted forward. What I'm doing here, I found this spine. I'm not pushing on the spine. I get this laminum groove. Let me get my spine. So, a lot of people get this tilt. What I'm doing here, I found this vertebra. I put it right in here because most people, they slouch right in here. 1, 2, 3, 4, 5, 6, 7. Yes, right in here. This is where your head starts shifting. Right here, right? So what we want to do, we want to get this back, right? We want to get this neck back. We want to lock it in. All those vertebrae, we want to lock it in. So this is what I'm doing here. I found this C7T1. I grab his hand, so I place my hand under his head right here. I lift it a little bit. You see, my hand is straight. It's not, I'm not bending, I'm not doing here, and I'm not doing this. I'm straight, I'm standing. My other arm, find it C7T1. Apply this elbow towards my body, so I locked. Now I'm rotate this head to 45 degrees. And all I'm push with my hip down this direction. Here we go, looks like this. How's it feel?
It feels good.
Yes, and I'm getting to the first barrier. It feels a little restricted up there. I ask you to rotate your head back towards the table. So you see, he's pushing down. I want you to rotate. I'm show it to him. I want you to rotate. Okay? So I show the motion. A lot of people don't know how to do motion because they've been disconnected from here. They don't know how to operate. The motor control problem problem up there. So here we go. Attach it, rotate back. Rotate. Push constantly. Push, and let it go. Relax. And you feel that?
Mm-hmm.
Yes. And it's just a little click up there. And I can tuck that chin. See that motion? Tuck the chin. and release. All right. Very gentle. Always communicate. Sometimes it's a sore spot up there. You have to always ask your clients. Okay, ladies, let's do this upper traps and a little bit work on this douch hump, and we should be good. And you can also introduce yourself when you do massage. And yes, you can next time bring the tripod. It's going to be good for you. It's like, yeah, it's like $10. So, all right, here we go. Jump in. That one is so easy. Use this arm. So watch me. Watch. This one on top, and that one. No, this one is lock it and hold. But this one you use. Here we go. You see? Because the right hand, you're right-handed, right? There we go. Now make it straight like a flying Superman. Like, whoo, like this. First, back up, whatever you feel. And now just watch. Just lean with your body. Just lean. Slide. Look at that. This is amazing. And this can be in your house. Do these massages. It's $187 for the home massage. And what's $207 for 90 minutes? Full body for $200. How amazing is that? With those skills. No one's skilled in LA like LifeRx. Yeah, we should do championship here. Right? Flying Superman. Let's call this Flying Superman now. Yeah. He can resist too. He can push this shoulder towards you. Resist. Yeah, while you're doing this one is shoulder down. Perfect. Look at that postural. Look at that back. No one get hurt. She can do this all day long. All day long. Do you drink any stuff? Medication? Okay. Yeah, a lot of people, COVID is back. A lot of people with the COVID. Yeah, but everything is show COVID. Yeah, that's great. And you go all the way, up here. A little bit to the back, posterior neck. Don't go to the front neck. So we don't want to put on. Resist it. So you always resist every time. So idea is pushing. It's constantly feel his muscle. He's strong or he's not. Because if you're gonna do other shoulder, and you will see the difference. This shoulder is like no problem. Watch my shoulder. This one is like I need to work. So through this fist, through this pushing, you let him know which shoulder is weak, and he needs to work on that. And you will feel this too because of this. Because we're always like that. And guess what? He's going to be really hard to move that shoulder. Go ahead.
First, we're going to do without.
Without, yes.
For how long?
I don't know. It depends on you. It depends on person. If he's so tight, if those bodybuilders guys, they like shrugging, they can't relax. You always try to relax him. And trust me, he's not relaxed in here, in the head. So the muscle is not let to be fresh. Well, relax. So slowly, without anything, ask him to breathe. And when he's breathe out, you relax. But when you find those tight spot, you ask him to push against you. You find those those like knots. People say this, I feel that knots. It just get those. That's okay. Yeah, you feel that. Yeah, get that fist.
Up the shoulder.
Yeah. Yeah, you push and you just hold it right there. This arm is straight. Here we go. Yep. And relax. 3-4 seconds. So he push you like you always calculate for him. You don't know how long he's have to push. You just say push and I calculate to 4 or 5. You do 1, 2, 3, 4, 5. Relax and he's dropped the shoulder. You go more. So you get this more and more and more deeper relaxation. Deep. Yeah, he's falling asleep. You see, he's falling. This is how people fall asleep. Yeah, because this is not put the people in relaxation mode. The deep work, that's what people put in a relaxation mode. Good. And yeah, you can scoop all the way to this occipital. Don't go to the midline because it's the nerves on the side and working on that. Yeah. I have a next lady. She's come with the TMJ. This is great for TMJ too. All those necks is great for TMJ. So, and relax. Great. Greg, excellent. Oh, don't worry. All right. Are we done, Marina? You good with this one? Yeah, she's done. All right, so we did a lot of side position, and of course, switch to side. And guys, we can show you more technique for the sides. It's a lot of, you can work on the scallions, you can work on those, the sternocleidomastoid muscle in this position. This is the perfect position for your customers. What else? Oh, you can do this nice manipulation. Go ahead and flip. No, on this side. Here we go, close to me. Yes. So you see, he's get close to me. Let me pull this away. This is a lot of people, a lot of massage therapists. When they see this, they like, wow, I want to do this. But this is chiropractic thing, and we're not chiropractors, so we don't use any force. A little bit more towards me. So make sure he's on the edge. He's not going to fall anywhere from the table. I'm always stay up here so he knows he's not going to fall. I'm always going to catch him. This leg is straight. The down leg is straight. This one is bend and get close to this butt. So you see, it's get closer. Now he's in this landing position. I grab his arm, the lower arm, and I pull towards me. I pull more. And I get him hug himself. He's hug himself, and what I'm doing, you can get this arm right in here and grab this, and you see you can roll this way. Because I'm a big guy, I can just place on that shoulder. The next one, I'm get to my leg on the top of his knee. You see what's happening here? And all I'm like a joggling. What's the call? Yeah, joggling or jostling? Yeah. So I'm kind of push this down, and this one towards the table. I can apply a little hand right here on that ilium and help. So it's come right in here. The chiropractor, yes, they ask him to take a deep breath, and they push it down, and here we go. Push this way, he's already cracked. But we're not a chiropractor. We don't do any spine manipulation. I know you guys want that, but this is what it is. Always kind of like gently. Take a deep breath. Yeah, and more. Okay, this is the great technique. Well said. You guys have any questions about marketing, about massage, about questions? No? Or you do?
So the thing is another thing with the neck.
Oh, the douch hump? Yeah, let's come back to do douch hump. Just remember this, we forgot to do douch hump. So a lot of people get this Quasimodo head. They walk like this, and that's really like scary. Now, I'm just going to tell you, just think about it. This is artery and nerves come up here, and what's happened, you drop your head, and it's jammed everything. The blood is not coming through. The oxygen is not going through. What's going to happen? Stroke, right. Arthritis, you're not going to move your head. You're not able to turn around, and it's caused a lot of danger. All right, here we go. So you come up here on the top of the table. Let me get this camera. And if I be you, I use my left hand to hold his head. Perfect, right there. So find that bump right there. You feel that? So place like a tuning fork, like you try to grab like this. You see? That's the grab. Like 2 fingers. 1. Yeah, here we go. You found it?
Yes.
Now turn this head to a little bit 45 degrees, so it's easy. Like this. So you just, here we go. Drop your, and now get this arm close to your body. So get your arms close. Here we go. Lean. Perfect. Right there. And now you rotate this head up and turn down. This is all you do. There we go, just like that. You see, I'm raising it up. Guys, this is the class technique. You have to be here to feel that, to see that. And I'm going to help her out. No, just hold it. I'm going to be with you. No, hold on. Here we go. Find that. Right, yeah, I know. And you just like this. Kind of like this. Yeah, perfect. You see what we're doing here? Excellent. How's it feel? Ask him. Now ask him to push down your head down. You see what he's doing? And you relax and you do more. Look at that. And we want to get a little bit to 80 degrees. All right. Yeah, all this, you see my hands and my body. It's not in here, it's here. So I use my body. This is what massage, like manual therapy. If you're doing this, your elbows everywhere, your hands everywhere, your shoulders everywhere, it's not going to, like you're going to injure yourself. Boom, boom, lock, boom, and that's it. Great. All right. Did you get that? Do you like it? It's hard. That's okay. Yeah. If this is hard, you remember we do in a supine position. Let's show him in prone position. Sorry. Let's go prone. Yeah. If this Dao Champ, we work in the prone position. Get the customers right here. Get his arm on the side. This is another technique. I'm stay on the side. Yes, I get that Dao Champ. Let me get this really close. And what I'm doing here, I've found this C71, and I ask him to raise his head up, and I'm slide those fingers down. Yeah, and tuck your chin, tuck your chin. Here we go. Look at that. He's tucked his chin. Look up, look up. And when he's tucked the chin, I slide down. This one is a little bit, so I have to stand up this way. My shoulder was a little bit. There we go. And up. And I'm going a little bit like mid back. Slide, raise up, look up, tuck your chin and lower down. That's another work for the Dao Champ. It's a lot of technique to work on specific problem in the body. You just apply which one you want, and that's the key. All right, it's almost 2 o'clock. We should be all set. Thanks for guys joining us. 18 people, this is great. So guys, leave your comments below. Leave where you come from, what's your name, and what's the purpose of watching those videos. Are you a therapist, or you maybe a fitness coach? We always welcome you. All right? Thanks for watching. We'll see you next class.